Hi everyone, my name is Dr Zoe Fisher and I work as a consultant clinical psychologist in a community neurorehabilitation service in Swansea Bay Health Board for people living with acquired brain injury. I also work as an associate professor in the Health and Wellbeing Academy at Swansea University, and this job really gives me the opportunity to look at some of the research about well-being. We've been able to develop our own theoretical models of well-being and translate some of that work into my everyday clinical practice to help people living with brain injuries to experience well-being again. Today's presentation, we're going to talk to you a little bit about building a positive mind. But before we do, I'll just talk a little bit about what is well-being. Through some of our work, we've shown that well-being is really made up of several important components, one of which is positive experiences. And so that might include the experience of positive emotion, a sense that life has meaning and purpose, and that you're connected to something bigger than yourself. Social connectivity is really important, our relationships and our sense of feeling that we belong to a community and we can contribute. Spending time in nature and feeling connected to nature can be really important. And also engaging in positive health behaviours. We're going to cover each of these topics in this video series, but today we're going to focus on building a positive mind. And so well-being can be thought of as feeling connected to ourselves, to others, and to the community and environment that we live in. So if I had to describe well-being in a word, it would be connection. So one model of well-being that I found particularly helpful is a model by Martin Seligman called the PERMA model, which you can see on your screen now. So the PERMA model of well-being says that there's 5 critical aspects of well-being, and these include positive emotion, engagement, relationships, meaning, and achievement. And so if you think about the effects of brain injury, I don't need to tell you that it can have a devastating effect on all aspects of well-being. And so at least in the initial stages, positive emotion can be replaced by low mood, by anxiety, by adjustment difficulties as people struggle to come to terms with the way in which their life has changed. And people tell us that if they're not able to engage in the hobbies that they used to enjoy or return to work, there are opportunities for engagement, for meaning and for achievement may be limited. People talk about how brain injury can affect their relationships with other people and their ability to connect with their community and contribute. And so you can see that brain injury can have a devastating impact on all of these critical aspects of well-being. And one of the things that we've been thinking about in our service is how do we put some of those things back for people? And so when we look at models of well-being, one of the most interesting findings really is that well-being is not simply the absence of distress. And so often when we think about psychology and what psychological therapies bring, there can be a focus on reducing the distress associated with brain injury. And of course that can be hugely helpful for people as they negotiate those early stages and even further down the line. What our models are showing is that does not go far enough, because what we also need to be thinking about is how do we also build in opportunities for positive emotion. And so just a few things before I start talking about some techniques. The first thing is that the techniques that I'm going to talk about are very simple, but they need to be practiced often to be helpful. And the second thing is it can be really helpful to practice some of these techniques because it can give us a sense of control, that we're not just the recipient of negative emotions, and there's something we can actually do to try and build in some positive emotion and positive experiences. And I also need to say that it can be really difficult sometimes to even think or hear people talking about happiness or positive emotions when you're in a really dark place. And it's not our intention at all here to be suggesting that people need to be positive 100% of the time. I mean, that's absolutely not possible, and it's not even desirable, because very often negative emotions can be really helpful, they can be really informative. The important points are excessive levels of negative or positive emotion can be unhelpful. Pressure to feel upbeat all of the time, or a relentless pursuit of happiness, can actually lead to lower levels of well-being. In certain situations, negative emotions can be adaptive, appropriate, and motivating. And research has shown that people who are accepting of negative emotions have better psychological health than those people that have struggled to accept negative emotions. So ultimately, it's all about balance. And so the techniques that I'm going to talk to you about now are designed to restore that balance if you're feeling overwhelmed by negative emotion. In this next section, we're going to talk a little bit about strengths. And so when people first experience brain injury, there's a lot of focus on what people can't do, and that can be really important to help people understand some of the difficulties that they now experience after brain injury, and to help people find ways to circumvent those difficulties where possible. But ultimately, some of the difficulties people experience after brain injury can be long-lasting. And so it's equally as important to help people think not just about what they can't do, but what they can do. And so this discovering or rediscovering what your strengths are can be a really important step in this journey. And so your strengths are qualities that are unique to you, that make you who you are. And very often I sit with people in the clinic room, and there's people sitting in front of me that have got so many qualities, so many talents, so much to offer, and I ask them what their strengths are, and they say they don't feel like they've got strengths anymore. And so one of the most helpful things I feel that I can do sometimes for people is to help them reconnect with the qualities that I can see that they can bring. And so one way to do this is to fill in this character strength survey. So we're going to put the link for you on the screen, and I'm also going to show you 24 character strengths that all humans possess. And so the question for you is, what are your top strengths as a person? And so there's a bit of a disclaimer that goes with this, and that is that when you fill in your character strengths, it can be quite a long process. So it can take about 40 minutes. It can feel frustrating, although you don't have to do it all in one go. But I wouldn't be suggesting you did it if I didn't think that the ends would justify the means. So hang on in there. Attempt the survey. So you go to the website, you have to register, and then you fill in your VIA 24 character strengths questionnaire. And once you've finished, make a note of what your top 5 strengths are as a person. And so these should feel like they really fit for you. And then what I want you to do is to think about how you use your strengths at a time when you felt the most happiest. And so for many people, that time will be before they had their brain injury. So you've got these series of strengths, but in order to use them, identify what kind of things you were doing. And so, for example, someone that I worked with was a nurse, and she said she got to use her character strength of kindness through her job. Other people have said their jobs didn't give them the opportunities to use their strengths, but they used them for voluntary work, for things they did outside of work, and in their families. So think about how you used to use your strengths at a time when you felt happy. And now think about how you use your strengths now. And what we tend to find is when people are feeling low in mood or distressed, or they feel lost after a brain injury, very often what's happened is that they don't have an outlet to use their strengths. And lots of research has shown that if you use your strengths every day, this can really contribute to your sense of well-being, meaning and purpose. And so one of the things that we encourage people to think about is how they might be able to use their strengths in a different way after the injury. And that can feel really helpful. So the people that have reconnected with their strengths and then have thought about how can I find a new way to use these, have reported to me that they felt more like the same person that they used to be. And others have said, I'm not the person I used to be, but I feel happier now. I'm connected with something that I'm good at. It's given me confidence. It's given me motivation. And so try your character strengths questionnaire and think about ways in which you can use your strengths in order to connect with a sense of meaning and purpose again if you're feeling a bit lost. In this section, we're going to talk about flow. So you might not have heard that term before, but when I explain what it is, you may be able to relate to the experience of flow. And so flow is a state where you get completely immersed in a task and you lose all sense of time. So you might emerge several hours later thinking, where did the time go? And so people achieve flow through different things because that depends on what they're good at, what their strengths are, and what they enjoy. But the key point about flow is that you can only achieve flow when the challenge is sufficient for your skill level. So if a task is really easy, you might enjoy it, but you probably won't get into flow. So for example, an accomplished pianist won't get into flow by playing Happy Birthday. And if a task's too difficult, we'll probably just get frustrated and give up. So that state of flow is where you've got sufficient challenge for your skill level. So think a bit about how you've achieved flow previously, and if you can include that activity more in order to get a sense of well-being, because flow is shown to be really good for us. In the PERMA model that I showed you by Martin Seligman, flow relates to engagement, which has been shown to be really helpful in supporting well-being. The negativity bias, or the negativity effect, refers to our natural predisposition as humans to notice and focus more on things that are negative in nature and threatening to us. And this is a natural tendency that all human beings have. And sometimes when people experience trauma, that tendency can become even greater. And so sometimes it can be helpful to do some simple exercises, which I'm going to talk about now, that can help you attend more to the small positive things, which can have a big impact on your mood. And the first exercise is called the 3 good things exercise. And this is really simple, but if practiced, has been shown to be really effective. And so what you need to do is just simply at the end of your day, on a notepad or using your phone, just record 3 things that have worked well for you during the day, or 3 things that you're grateful for. And they just need to be really small things. And if you can't think of 3, just start with 1 and build up. So people that have done this exercise always report that it can be quite difficult at first to think of 3. So they have to trawl through their day and try to remember 3 positive things, like somebody made me a cup of tea or the sun was shining. But after doing this for about a week or 2, people start to notice that they don't have to trawl through their day because they're noticing these things in the moment and thinking that they're going to record them later. And so their brain is actually more aware of these positive things in the moment. And then towards the end, people have actually started constructing their own positive moments. So they might think, before I rush out the door to go to work, I might spend a moment cuddling my dog, and that can be one of my good things. So try this exercise and see whether it's helpful for you. The acts of kindness exercise is exactly what it sounds like. This exercise involves doing a kind act for someone every day or every other day or as often as you can manage. The important thing is that it has to come at some cost to you. So it might be that you've given up your time to help someone, or you've put a lot of effort into doing something kind for someone else. And doing good things for other people has a massive impact on our mental health, but also our physical health, including our heart health. This always works really well when we do acts of kindness when we're running our positive psychology group. And I always remember one person that used acts of kindness whenever she felt sad or stressed. So she always used to say that she was having a stressful day, or she'd received a letter that had really stressed her out. And so instead of sitting there feeling bad about something she couldn't change, she used to deliberately choose to do 3 acts of kindness for someone as her coping strategy. And that worked really well. So this exercise is really helpful to supporting a positive mind. So to sum up, in this video, I've talked a bit about what well-being is and what the key components are, about feeling connected to ourselves, to others, and to the community and environment in which we live. I've also talked about how brain injury can have a massive impact on all of the factors that contribute to well-being, and how the absence of anxiety or stress, depression, is not the same thing as well-being. So we need to think about how we can also build well-being, as well as thinking about how we can manage distress or anxiety. When we feel negative, or when we feel overwhelmed or stressed, our thinking can become quite narrow. But when we feel more positive, our thinking can become broad, we're more creative, and we're better at problem solving. So I've talked you through some techniques today that, if practiced, can support the increase of positive experiences, and this can help build resilience, help people feel more confident, more connected to others, and help you face some of the challenges that rehabilitation can bring, as well as some of the challenges that life brings. The idea is that practicing these techniques every day is just a starting point to increase positive mood, because we know that that can help people feel more connected to themselves and to other people. I hope you found these techniques helpful, and thank you for listening.